Hello everyone, good evening. Back again. So today's topic is super interesting and the guest is even more interesting. So let me just check if our guest is there. So I've been always talking about endometriosis. So today's topic is a little different from endometriosis, somewhere related, but still a little different. Yes. So a lot of women with endometriosis suffer with fertility problems. It's about 40% of women with endometriosis have problems with fertility. So today our topic is something related to fertility problems in women with endometriosis. So here are our guests. Yeah, hi
Hi.
Aditi.
Hi, Shilpa.
Hi, I'm so happy to have you here.
Thank you for having me.
So the topic for today is preservation of egg freezing. All right, and I don't probably have to introduce Aditi to people because she is so popular over the Instagram that I think everyone knows her, the fertility doc, right? So Dr. Aditi Tandon is a gynecologist, obstetrician, laparoscopic surgeon, and fertility expert. So she is the epitome of beauty with brains. So Aditi, first and foremost, I'm actually diverging from the topic, but what got you interested in laparoscopic surgeries?
So, basically during my residency, I was exposed to laparoscopy. My lecturer was learning at the time, and I just happened to assist him, and it kind of me assisting him, and then I was exposed to so much laparoscopy that I realized that maybe this is the way forward for solving so many issues for women, because you'll be surprised, there are still so many people that don't offer laparoscopy to for so many conditions, so many gynecological conditions, and I think you can practically do everything laparoscopically. In today's time, we can safely say that minimally access surgery for gynecology can be done for pretty much anything and everything, apart from like a cesarean section.
Absolutely true.
Yeah, so I
Amazing.
think that's why I decided that I would love to train further in laparoscopy, and that's what I did, and I followed my path of passion.
You've been training extensively, yeah. You've been
Yeah,
training
I think
extensively.
learning never stops. It never stops.
True,
Yeah.
absolutely true. So, as Aditi says herself, that she aims to educate women regarding their reproductive and sexual health on social media in order to empower them to make better decisions. And I couldn't agree more. I mean, this is so needed at this point in time. Women taking their own decisions is something they need to know.
Absolutely. Knowledge is power, and once you're aware of certain things, you're able to make better decisions for yourself. So disseminating knowledge is what I'm here for.
No, and I appreciate what you're doing. I love the work that you do. I've been following you for a while, and the work that you have been doing is simply amazing. It is simple to understand.
Sorry, I think I lost you.
Yeah, it's fine now.
Yeah, no, I have to
it's all right now.
You're also doing a great job in raising awareness about endometriosis. I think it's fantastic. You yourself being someone who has suffered from it, I think you're doing an absolutely phenomenal job.
Thank you so much. Thank you so much, Aditi. I think the pain brings out passion, so probably that's what happened with me, and it's just given me a purpose, So let's just jump into the topic directly. So endometriosis, a lot of people know, and a lot of people I speak to have fertility issues. So, how does endometriosis impact the fertility and the egg quality? And how can egg freezing help in fertility?
Yeah. So basically, just to kind of simplify things for people who don't know what endometriosis is, the endometrium is basically the lining of the uterus, right? And if this endometrium is present outside of the uterus, it's endometriosis. And basically, menstruation every month is shedding off the endometrium, right? Because of the influence of hormones that our ovaries secrete. So imagine these same implants outside the uterus bleeding every month. What do you think will happen? Even blood being between two pieces of paper, it'll get stuck, right? So adhesions happen. And basically, in the ovary, there can be there can be chocolate cysts, endometriomas, basically blood-filled cysts. So the commonest form of endometriosis is a chocolate cyst and endometrioma, what we see, which we can see on a sonography. And how basically this impacts the fertility is it basically affects the quality of the eggs, right? Not only does it affect the quality of the eggs, it also impacts the implantation. So it causes infertility in various ways. Also, of course, if you have like a cyst in the ovary is where your follicles are forming, the ovary is where your eggs are being produced, right? So if there is a large cyst in the ovary, obviously it will impact the growth of these follicles, and obviously it will impact the quality of the follicles. That is if a surgery has not been done already for endometriosis, right? Not only that, endometriosis also causes dyspareunia. So that further, dyspareunia is basically painful intercourse, right? So that further, causes increase in infertility of the couple. So this is when a surgery is not being performed. But if a surgery has been performed for a cyst, like if the endometrioma has been excised, obviously you're going to impact the egg reserve, because the ovarian tissue while the surgery can be damaged. So that also impacts the egg reserve.
Okay, all right. So, what is the best age or the stage of endometriosis to consider egg freezing? And when does one need to do it?
Yeah, so to answer your previous question, how egg freezing can help in endometriosis is basically, if a woman has these endometriomas, we know that she will need, surgeries to kind of excise these endometriomas, these cysts. So we know that it will impact her ovarian reserve, right? So to preserve the ovarian reserve, we advise egg freezing for these women. And if they have a partner, we advise embryo freezing if they don't want to immediately get pregnant. Obviously, we cannot, we know that pregnancy is something that will, halt the process of endometriosis, and it will also halt the progress of the disease. But if a couple does not wish to get pregnant, you cannot just tell the lady, okay, getting pregnant is the only thing that you can do. That's not fair. So, so egg freezing if she does not have a partner at the moment, and embryo freezing is a way to kind of preserve the fertility, because we know that these multiple surgeries on the ovary to remove the cysts is going to impact the egg reserve and is going to destroy the ovarian tissue. So that's how, especially if these women have bilateral cysts, often they come with cysts in both the ovaries. So that, her egg reserve is going to be impacted.
Okay. So what's the right age to get it done, or what stage of endometriosis do you generally advise of egg freezing?
Yeah. So, look, I think the earlier the better is what I would say for the age as well as the stage of endometriosis. But obviously, at 20, you're not going to know what you're going to be doing at 30, right? You don't know where life will take you. So maybe to give it a number, maybe ideal would be before the age of 30. But again, having said that, I would say even if you've crossed 30, it's never too late. You know, you should consider it at whatever age that you need it, basically. Even at 30.
I think there is some problem with the network. Just 1 second. I think there is some problem with the network. I'm not sure, but 1 sec. Sometimes technology starts playing games.
Yes. Especially when we need it the most.
Exactly. I think it's better now. Yeah.
Yeah. So basically, ideal would be 30, but it is never too late. And for the stage of endometriosis, the earlier, the better. Because any kind of endometriosis is basically inflammation in and around the pelvis, right? So this inflammation is going to hamper the quality of eggs.
Right.
So
I get that. So absolutely. So so are there any specific conditions where you specifically advise for egg freezing?
Yeah, so like I mentioned, especially for somebody with, bilateral chocolate cysts, in endometriosis, that is one, if we are considering endometriosis. But basically, indications for egg freezing, you can divide it into social reasons or medical reasons, right? The social reasons, of course, would be if you've reached a certain age where, you don't know what your future fertility is going to be like. You don't know when you are going to plan to have a pregnancy. If you don't know the timeline, then you can consider, and you should consider, egg freezing, right? If you've not found a partner, say if you're at 35, definitely consider egg freezing, because we know that women come with a fixed number of eggs, which is genetically determined, and the quality and quantity basically deteriorates as we age. So this gives us a great opportunity to kind of take things into our own hands. It allows us to empower ourselves and not have to worry about the decline in fertility. So social reasons is one. Medical reasons, of course, there can be conditions where so most often, if someone who suffers from any kind of cancer and has to undergo chemo or radiotherapy, this is when chemo or radiotherapy will again affect the ovarian tissue, and it can hamper the fertility. So it's advised to freeze the eggs before chemo or radio is underwent. So that's one of the most important reasons for egg freezing, for medical reasons. And social reasons that I mentioned, it's no longer considered experimental. Most organizational bodies have considered social egg freezing as safe, and it's no longer considered experimental.
True. It has become very prevalent, and I'm glad people are talking about it.
Absolutely.
I said, I'm glad people are talking about it.
Absolutely. Some companies even, provide insurance for egg freezing, which I think is absolutely fantastic.
That's a fabulous thing to happen.
Yeah.
True. So, how much does insurance cover the process completely, or how does it work with insurance?
Right. So basically, when I spoke of insurance, it is still very much nascent in India. in
It's still
India, even
in
IVF
process.
not, yeah, it's still in process. Even IVF is not
Hmm.
covered by insurance, and I really, I don't understand it, because they think that infertility is not a disease, which,
I understand.
yeah, which is absolutely ridiculous. I mean, having a child is each and everyone's right, and if for any reason, why not, give them the best way? I mean, why not give them support for it?
That's true,
Yeah.
true. It's not easy, and if an insurance company covers an IVF process, I think it'll make life much easier for a lot of other people, you know. So
Absolutely. Yeah,
I'm
yeah.
sure you must be seeing patients day in and day out, and I know it must be heartbreaking to see people not being able to go for it due to the lack of funds, you know.
Yeah, I think we
So,
are we are seeing a change, but let's hope, because
still a long way to go.
yeah, it's a long way to go.
Yeah, I understand. So, what what do you think is the success rate of egg freezing in a person with endometriosis vis-a-vis a normal person?
Yeah, so basically, success rates would actually not really differ that much, unless, there is ovarian endometriosis, like I mentioned, like an ovarian cyst, or like a previous surgery that has already happened on the ovary, which has, caused a reduction in the AMH, which is basically, AMH is the egg reserve of the woman. In terms of the number of eggs that we would retrieve, it would again just basically be determined on the AMH. And we will basically not be able to understand the quality of the eggs until we can, to an extent, when we visualize the eggs that are retrieved. But eventually, quality we will only know once the eggs fertilize. We'll only know if they fertilize and how the embryos grow. So, as such, I wouldn't say that endometriosis will affect the success of egg freezing. But yeah, if the egg reserve is hampered in any way because of the cysts and previous surgeries, then yes, it will impact the number of eggs that we retrieve. Also, the quality of the eggs will be impacted, which is why
Okay.
should be advised to women with endometriosis to kind of, preserve their fertility.
So, so the inflammation that happens because of endometriosis, uh, does it impact the quality of egg? Is what I
Yes,
meant.
yes, absolutely. It
Yeah.
does. It does.
It does, right?
Absolutely.
Yeah.
And when you say it impacts the quality of egg, it will basically impact the chances of the egg to fertilize.
Because what happens is, Dr. Aditi, the problem is by the time people get diagnosed with endometriosis, it is already so late. I mean, early diagnosis is just not happening, right? For me, it took me more than 2 decades. So, which was like a very, very long time,
Absolutely.
right? So,
Like, you read anything about endometriosis, this is the first thing that comes across, that
yeah.
you come across, that the time to diagnosis is always delayed. And this is only because, I think, uh, women as well as doctors are at fault to an extent, because I think we just think that, okay, we're supposed to bear with the pain that we face during periods. And sometimes even doctors just dismiss it off, saying that, okay, periods are supposed to be painful. But I think if you don't think of it, how are you going to diagnose it, right?
Right. Absolutely. So we are
Yeah.
conditioned in that ways
Yes.
that,
Yeah.
it's normalization of pain,
Absolutely.
especially when it comes to, women or the third gender, probably,
Absolutely. Absolutely. Which is
So that's
why raising awareness is so important, because if they don't know what's normal and what's not, they're just going to think everything is normal, what they're facing is normal. But if they think that, okay,
true.
they're not normal, and then they seek help, that's when, there is a chance of it being diagnosed.
Absolutely, absolutely. So, for a layman, Dr. Aditi, can you explain the process of egg freezing? And is it any different for women with endometriosis?
Okay. So basically, egg freezing is, a way with which a woman's fertility can be insured. It can be secured, right? So how we perform it is we give injections, which are basically hormonal injections from the first or the second day of period. We give these injections for daily for about 10 to 15 odd days. These injections basically are, they aim to stimulate the follicles in the ovaries to form, uh, they stimulate the ovaries to form follicles. We want multiple follicles to be formed during the stimulation. In a normal menstrual cycle, one follicle is what is formed. So one follicle forms, one follicle ruptures, which is ovulation. So there is only one egg which is released each cycle normally. But in egg freezing, we want multiple follicles to form. So we give these injections for these multiple follicles to form, and we perform ultrasounds, sonographies, transvaginal ultrasounds to see how the ovaries have responded to these injections. Right? We form serial sonographies from, say, the seventh or eighth day onwards, and we have a look at the follicles, and each follicle should ideally have one egg, right? So once these follicles in the ovaries are mature, we give a final trigger to mature these eggs, and then we perform the oocyte retrieval procedure, which is again performed under anesthesia. It is performed via transvaginal sonography. A needle is attached to the probe of the transvaginal transvaginal probe, right? And the follicles, consider the follicles like, a balloon. So we basically put in the needle into the balloon, and we aspirate the fluid from this follicle, and the fluid has an egg, right? So we
Okay.
aspirate each follicle in the ovary on each side, and these eggs are just basically frozen in liquid nitrogen. So they are, frozen at a very low temperature, and these eggs can then be used whenever, there's no time limit, there's no timeline until when we can use these eggs. They can be used whenever we need the eggs, right?
All right.
Yeah.
Get that.
So
So,
yes.
generally, how many years? Generally, what is the timeline that generally you have seen, or that you have come across?
Age, yeah. So we
Yeah.
see women between 30 to 35 who
Okay.
even, yeah, in fact we've had women who were even 38, 39 who came for egg freezing,
Okay.
so like I said,
Mm.
it's never too late, and
True.
you will not regret it. If you don't do it, you will regret it,
Mm.
right? Because the technology is there, why not use it?
Right. Right.
Yeah.
That makes sense.
Yeah.
So, as a practitioner, is there any particular number of eggs that you think should be should be freezed for a better conception later?
Yeah, so basically, it is said that for having one live birth, you would need at least 15 to 20 eggs.
Ah.
Okay, that's
Okay.
ideal. Ideal. So
Hmm.
if you can get those number of eggs in one stimulation cycle is all you need, right? You will get those many number of eggs in one stimulation cycle if your AMH is normal, and if you are not, say, above the age of 35. But if your AMH is already low, or if, say, you're above the age of 35, 36, there is a possibility that the number of eggs that we retrieve, or the ovaries will not be able to be stimulated enough because the egg reserve is less. So you would probably need more than one cycle to get those number of eggs,
Hmm.
right?
Right.
So
Right.
So it will depend on your egg reserve and your age to know how many eggs you will get, and which will in turn determine how many cycles of egg freezing you would need. Most women are good with just 1 or 2 cycles.
All right. Okay. That sounds good to a lot of people. I'm sure a lot of people listening to you must be getting a ray of hope.
Yes,
You know that probably in future it is possible. And
absolutely.
so as as women, is there any lifestyle modification that you generally recommend to increase the quality of the egg that is formed? Like any lifestyle changes, exercise, diet, or
Yeah,
anything like that?
yeah. So I think, with any condition, lifestyle changes are very important. But especially with endometriosis, because there is so much of inflammation that happens, that an anti-inflammatory diet is definitely something that helps. And this is not spoken about much.
Very
you know
often. Yeah.
yeah, it's not spoken about very often at all. um, like an anti-inflammatory diet, something which will avoid anything that will cause. So basically, when you talk of food, it's just two things. It will either improve the inflammation, reduce the inflammation, or it will increase the inflammation. There is no
Right.
middle ground.
Nothing
you know
in between.
there's nothing in
Mm.
between. So when you're eating, what is going to improve, what will be an anti-inflammatory kind of a food, and what will, so things that are things that are inflammatory are something like, refined flour, or sugar, or saturated fats, or things that are fried food, and all of that, right? An
Mm.
anti-inflammatory diet, on the other hand, is green leafy vegetables,
Mm.
nuts, seeds, things that have omega-3, even some spices like cinnamon is an anti-inflammatory product. Things which, even antioxidants, right? There's a lot of discussion about antioxidants also in endometriosis. uh, of course, food that has antioxidants is high colored fruits and vegetables. We know that. But you also get supplements which contain, a cohort of antioxidants which will improve endometriosis. Things like coenzyme Q, or, N-acetylcysteine, or even resveratrol or melatonin. All these ingredients are antioxidants, which, of course, are present in food also, but they can also be taken as supplements to improve endometriosis. So that is talking about food. Exercise definitely helps. We know that when we exercise, endorphins are released, and endorphins are natural painkillers, right?
Yeah.
Endorphins are basically the opioids that the body secretes, right? So it's like a natural painkiller, and a regular, exercise routine will definitely help a patient with predominantly having a lot of pain and also infertility in endometriosis.
Yeah. So we have been focusing a lot on holistic healing when it comes to, endometriosis. So we have done a lot of sessions on diet also, obviously, because it does play an important role in managing. I would not say in curing, but yes, in managing the pain that is there. But so like now that you have also said that it affects the egg quality,
Yes.
I'm sure people would listen to you.
Yeah,
Because I
and
think
we only talk of these antioxidants, in terms of egg quality. It definitely improves the whole profile of endometriosis also. And you very rightly said that, it will not cure it. Anyone who's
that's
trying to
okay.
tell anyone who's trying to tell you that it will cure it is lying to you. Yeah. So because a pain predominant endometriosis can only be kind of managed with surgery. And when I say surgery, I mean excising whatever endometriotic lesions are present. you know
Yes.
So yeah, it
That's
will be
right.
supplementary. It'll improve the quality and all of that. But yeah, not cure it.
Absolutely. So let's come to the last section and a very important section. So what are the commercials involved when it comes to egg freezing? Is it super expensive?
Not in India. You know,
Okay. Hmm.
can you hear me?
Yeah, yeah, I
Yeah.
can.
Sorry, I just got a phone call.
No, no, no
Yeah.
worries. Yeah.
Yeah. So definitely not in India. It's very it's I would say it is probably 10 to 15 times more how much it costs in India in countries like in the US or in Europe. Um, in India, it would cost anywhere between about 1.5 to 2.5 lakhs, depending on how many cycles you need, how much dose of injections you need, how many days of injections you need, right? So, yeah, I mean, that for something which is going to kind of preserve your fertility, I think it is a very reasonable, figure.
Hmm. Hmm. Makes sense. Somebody is asking, do we have to like pay rent kind of for egg
Yeah.
freezing, egg
Yeah.
keeping
So
rather?
yeah. So basically, the eggs are frozen in liquid nitrogen, and the liquid nitrogen just basically needs to be, you know,
Replenished.
replenished. Yeah, replenished every time. So we just have a minimal amount for like a yearly kind of, charge for egg freezing, which is about between, again, that is between uh, 20 to 30,000.
Okay. All right. So that's like a membership kind of a thing
Yes.
that you
Yes.
pay.
Yes.
Right. Okay. So makes sense. I think it made a lot of it gave a lot of clarity about the process of egg freezing and what exactly is egg freezing. Is there any message that you want to give the women out there, Aditi?
Yeah. So, since we're talking about endometriosis, I think I probably didn't mention that how egg freezing in endometriosis is different compared to,
Mhm.
someone who does not have endometriosis.
Normally,
Yeah. Yeah. So in endometriosis, we often see the ovaries are stuck, behind the uterus or to the lateral pelvic wall.
right.
In which case, it might be a real challenge to kind of access the ovaries when we do a transvaginal sonography, right? If they are
Hmm.
stuck like really
Right.
high up behind the uterus or on the lateral side. If they're just stuck below, then it's easier, in fact, to reach the ovaries. But that's one challenge that comes. And of course, if there is a cyst, if there is an endometrium, if there's a chocolate cyst, sometimes we, inadvertently, that cyst can get ruptured while, retrieving the eggs. So the cyst is less than 4 centimeters, it's okay. But if it's more than 4 centimeters, it's definitely advisable to kind of do a surgery to remove the cyst and then do the egg freezing procedure. Also, if there are, if the ovaries are in any way inaccessible, then you do a surgery. You get the normal anatomy back. You restore the normal anatomy via a laparoscopic surgery. You free the ovaries, you free the tubes, and then you freeze the egg. Right? So that's just probably
Okay.
one thing that I
Hmm.
missed out on. Yeah.
Hmm.
And a message for women, I think, if you are in any way considering egg freezing, you should definitely speak to someone about it. Speak to a gynecologist, what it entails, what you would need to do. It's absolutely a safe procedure. It is a completely safe procedure. The kind of injections and the protocols that we follow, we offer it at our center, which is based in Chembur. So the protocols that we follow, and that basically every IVF specialist follows for egg freezing, is a very safe protocol. So it's very safe, And all of these myths were, in fact, I mean, I was really surprised. There was a gynecologist that was asking me that, if you freeze your eggs, are you going to is your egg reserve going to get reduced? And I was like, no, where are you hearing this from? It's such a myth. It's not true at all that all your eggs are going to be completely diminished, and your ovarian reserve will be diminished if you do egg freezing. Not true at all. It's absolutely safe, and if you are considering it, please seek consultation, and you won't regret your decision of wanting to freeze your eggs.
Absolutely. So Shruti asks, can people with 25 years of age do that, or only about 30? No, 25
Absolutely.
is pretty good.
25
Earlier the better.
Better than 30.
Earlier the better, because a lot of times you never know what's in store for you.
Absolutely. Yeah, absolutely.
And especially with things like endometriosis, it just strikes you like a hurricane, and it leaves you like all shattered and thinking about what exactly just happened, So
absolutely.
That's how it is. That's how it is. But any which ways, Aditi, this was an amazing session. This is something which I was looking forward to, because I really wanted people to know what egg freezing is all about, because I was never given the option before going for a hysterectomy. So I had no clue of these things happening. So I think maybe if people would have spoken about it then, things would have been a little better now.
Absolutely.
So saying that, you are doing an amazing job, Aditi, and please keep doing what you're doing and keep progressing.
Thank you.
Okay, and
thank you for having
me. And to anyone who,
it was a lovely discussion.
So anyone who wants to ask any question can put it in the comment section. We would answer the question. I would post the video on the group. So probably you can just put in your questions. We would be happy to answer. So, all right. And any topic
a question from Shruti Khurana, which says, if cyst is on one ovary, can we retrieve the eggs from the other ovary? So basically, when we give you these injections, the injections are not going to know which ovary to act on. You cannot, the injections will kind of act on both the ovaries. I think it will depend on the size of the cyst. If the cyst is 4 centimeters or lesser, you don't need to do a surgery. And if you are not symptomatic, if you don't have any pain, and if you also don't have any infertility, there is nothing that you need to do about the cyst if it is less than 4 centimeters. And if it's less than 4 centimeters, we can easily retrieve, we can stimulate both the ovaries, and we can retrieve the eggs from both the ovaries. However, if it is more than 4 centimeters, or if you are in any way symptomatic with pain or infertility, or even painful intercourse, then it would be advisable to have the cyst removed and then do the egg freezing.
Somebody has asked, ma'am, is it possible for a 25-year-old to get pregnant with 0.8 AMH?
Yeah, so again, 0.8 AMH for a 25-year-old is very less, right? It's not absolutely not possible, but you are lucky that you have done the AMH, and you are aware that you have a low ovarian reserve, so you need to act upon it. And I would say, if you do not with a 0.8 AMH at 25, I think just go see a fertility consultant and take it from there, because I would not advise you to wait, because once we see something is wrong, it's best to kind of address it. And there are ways of achieving a pregnancy naturally also with a low AMH. It's not that you will just have to directly jump to IVF, but my advice to you will be, don't sit on it, just seek help.
Absolutely. So concluding the session with the pointers that probably about endometriosis that I keep saying, that speak about it. If you have pain, please report it to your doctor. And if one doctor is not listening to you, please go to another doctor, be your own advocate. Second is pregnancy is not the cure for endometriosis. Whatever happens, okay, it will give you a stopgap for some time,
Yes.
but it will come back. So excision surgery is the thing that you have to go for.
Absolutely.
As much as we don't like surgeries, but unfortunately, that's the only thing here. And
Yes.
third, endometriosis is an inflammatory condition, so please be careful. It is endometrial-like tissue that can be present anywhere in the body. So depending on your symptoms, please talk to your doctor and talk about every symptom that you have, because that is where that will lead you to a diagnosis. Otherwise, you will just keep loitering between doctors. So
Absolutely.
Dr. Aditi, thank you so much, and I'm looking forward to doing some more sessions with you,
Absolutely.
and
I would
probably we'll
love.
get back together sometime soon. And thanks to all our audience who have always supported us. Thank you.
Thank you. Thank you for having me.
Absolutely. Bye-bye.
Bye.